Okay.
All
Well,
right.
thank you very much for staying with us. We had some technical issues here, and I'm just going to welcome all of you on behalf of the AHF Global Public Health Institute at the University of Miami, also on behalf of the University of Miami's Institute of Advanced Study of the Americas and IAPAC. So I'm just going to briefly introduce our moderator, who is Terry Ford. She's the Chief of Global Advocacy and Policy at AIDS Healthcare Foundation. She has been an activist for 30 years, a public health activist as well. And she wants me not to read the full bio, so I'm just going to follow what her desires are right now. So I'll leave you with Terry Ford to moderate this keynote conversation. Thank you very much, Stephen, for being with us, and I'll leave you on the hands of Terry Ford.
That's just fine.
Thank you, Jorge. I'm really happy to be here today as part of the Americas Conference, and I'm even more happy to welcome and introduce Mr. Stephen Lewis, who is an outspoken and respected humanitarian who has worked to improve the human condition both at home and abroad. And he's from Canada, so he's a companion of the Order of Canada, Canada's highest honor for life achievement. And he holds 42, and I was surprised when I saw it, 42 amazing honorary degrees from both Canadian and American universities. Just want to let you all know that Mr. Lewis also started his career as a member of the Ontario Legislative Assembly. And during his time in politics, he became a leader of the Ontario New Democratic Party and leader of the official opposition. Stephen Lewis served as Canada's ambassador to the United Nations from 1984 to 1988 and was the deputy executive director of UNICEF at the organization's global headquarters in New York. And that was 1995 to 1999. Mr. Lewis was the UN Special Envoy for HIV/AIDS in Africa from 2001 to the end of 2016. Currently, Mr. Lewis serves as the co-chair of the board of the Stephen Lewis Foundation, and he's the co-director of the international advocacy organization AIDS-Free World. And I just want to add that this is actually the first time that we've actually ever been able to meet Mr. Lewis after all these years. And it's just a real pleasure to talk with you today. Just before we get into the nitty-gritty of COVID, HIV, and the Americas, I just wanted to ask you, I've always wondered this, to start, what is your trick with your activism? Because you have been a part of the global health establishment, like what I just described, while never being shy to take them on publicly and very directly. And I've seen you do this in many forums around the world. And you still keep getting invited back. So I wanted to just start here with, what's your trick on that? How do you do that?
I'm not sure there's a trick to it, Terry, and thank you for that generous introduction. There's no trick to it. I've all my life believed that if you profess your principles in an unequivocal fashion, so that there's no vacillation and there's no equivocation, that eventually it's not so much that you win regard as, I guess, perhaps over time, a degree of respect where people say, well, we disagree with him and he's fundamentally irrational and he's a zealot not to be trusted, but he speaks deeply and honestly as he feels. And I think that probably helps. Otherwise, I don't know how to account for it. It's probably just compassion and generosity on behalf of my adversaries.
Oh, well, that's great. Well, I've always admired it in you, so it's great. Learn from you from that. Well, let me start with our first question. We have a few interesting ones for you. This AHF's theme that we created our own theme for World AIDS Day this year, and it's AIDS, the Other Pandemic. And that is to bring a focus back from COVID, to HIV, obviously. So the first question for you is, is the HIV/AIDS pandemic, do you feel it's already a forgotten pandemic due to COVID-19? And if so, how do you feel that we can reverse that?
Actually, Terry, and please call me Stephen.
Okay.
Call me Mr. Lewis. I'll be looking over my shoulder
Okay.
to whom you're addressing. I think HIV was already forgotten before COVID, and it's important, I think, for us to recognize that HIV was on a kind of downward spiral in terms of the world's response before the coronavirus made it much worse, accentuated what was already a dramatic falling off in public consciousness. And one of the demonstrable proofs of that is the report which UNAIDS released for World AIDS Day, in which they indicated that every single one of the targets set out in 2016 in the political declaration that were supposed to be achieved by 2020, there were 10 major targets. Every single one of them failed. Not a single one of them was achieved. And some of them, the disparity between the target and the reality was great. For example, they said that by 2020, there should be no more than 500,000 new infections a year. And there were last year 1.7 million. So more than 3 times the target. They said that there shouldn't be more than 500,000 deaths. And there were 690,000 deaths. In every area, and in all of the key population groups, there was this abject failure. And I think what it demonstrated was that the world was losing energy around HIV, which is really appalling because, there are 38 million people living with the virus. 26 million of them are in treatment, but that leaves 12 million people in tremendously vulnerable position. And the world is acting in a very halting and indifferent fashion. And then along comes COVID. And I'm sure that your audience is pretty sophisticated and knowledgeable, and everybody will know that what COVID has done is to disrupt the response to HIV, already in trouble. So they've disrupted access to medicines, they've disrupted access to treatment, access to care, access to resources. It is a very, very difficult situation. It's not as apocalyptic as some of us felt it would be, but it seriously compromises a return to a focus on HIV. And when you say to me, what do you do about it? You do, I think, what the AIDS Healthcare Foundation has been doing pretty darned impressively, and what we have tried to do in AIDS-Free World, which is to keep talking about it, incessantly hammering away at the human need which exists, and don't let the world get away with a degree of lethargic indifference, which ultimately kills the capacity to respond. Sorry to ramble on.
It's great. The new UNAIDS report is quite shocking. I think it's 384 pages. I'm going to really dive into it, but just in the summary, that you're right. Shocking that every single target was missed. So that is an indictment of the whole AIDS, community and global AIDS leadership. The other thing is you're right about, we focus on all the millions that don't have treatment. And if we went by the UNAIDS numbers, it's 12 million, but we actually think that 26 million, number on treatment may be cumulative, which means it includes people that are off treatment or have died. And these, we've called for audits of these numbers because we feel it's important to know to know the real issue, the problem. And so we think it may be even closer to 15 million people that are now on treatment. But whether it's 12 million or 15 million, those are millions of people that don't have the life-saving treatment that they need. And like we're going to keep fighting for those millions of people as well, and equal access to treatment, and as well as COVID. So let me ask the next question, and that is just bringing HIV/AIDS crisis back to the start. The initial diagnoses were confirmed mostly in developed countries, such as the United States and your home country, Canada. Only till much later did it become apparent that most of the affected region of the world was Africa, and poor countries, with a limited number of people getting diagnosed. So with COVID-19. Once again, the United States is the most affected country for a variety of reasons that we could get into for days, but is it possible that we're seeing a repeat of the situation we had with HIV/AIDS, where the richer countries are going to, get more of the focus, the poor countries are going to come later? And on that question, and the second part of that is, just on the vaccines, what are your thoughts on the safety and the rollout of the two current fast-track vaccines in relation to access in resource-rich countries and resource-poor countries as well?
Well, I think basically we're dealing with the patriarchal reality of capitalism, which is that inevitably the North will transcend the South, and that there is always this enormous reluctance ever to pay attention to low income and middle income countries and to exploit them as extravagantly as possible without feeling any particular moral responsibility. And that was clearly true in HIV, where the huge numbers in Africa were attended to only slowly and begrudgingly after there was a focus in the United States. The same obviously is true with Ebola. I mean, the United States would never have funded Ebola if Ebola hadn't suddenly turned up in the United States itself. And the response to the three countries in West Africa was ultimately energetic and successful. But frankly, that was driven as much by NGOs of conscience and capacity as much as any government or any international organization. So indeed, what we're learning about the World Health Organization now in the Democratic Republic of the Congo and Ebola is that there was a terrible episode of sexual violence apparently committed by members of the United Nations establishment. So it's such a complex thing, Terry, that the response in the wealthy countries is always more urgent and more concerning than it ever is in the international community generally and the low-income countries. And this is absolutely true now for the vaccines. I mean, here you have the United States, the United Kingdom, Japan, Australia, Canada, the European Union, everybody in the rich countries buying up millions upon millions of doses of the vaccine in advance, prior commitments. And when it will get to the low-income and middle-income countries is anybody's guess. It'll certainly be a 6-month lag in large measure for most of the availability of the vaccine. We'll get it in Canada. There's a huge foofara in Canada over when we'll get it. We've already purchased from Moderna and from Pfizer tens of millions of doses, and it's anticipated it'll come in the first quarter of 2021. But we're in a tremendously advantageous position. We're not sitting, even South Africa is not yet confident of when it will get the vaccines. And I should point out that just yesterday, they had the highest number of cases of COVID that they've had since it started. They have over 4,000 cases in one day. And there are pockets in South Africa that are terrifying, the levels of infection and death. And they won't get the vaccine until much later on. So partly, and I think this has to be said, partly it is racism to which we never give credence, because there's no question that Africa is Black, and therefore there's always this unstated reluctance to respond to Africans, and there is also not the vestiges, the actuality of colonialism operating, where you exploit these countries and you're not prepared to step in, and so without overdoing it, you amass all of the doses, and what's left over eventually Africa will get, or Latin America will get, or some of Eastern Europe and Central Asia will get. But it's also true of debt, which is a fine example. You've got African countries that are strangled by debt and debt servicing obligations, and the G20 says to them, well, you can pay it back, you can have a moratorium on payment until the middle of 2021, but we won't cancel your debts. Well, we've been through this story before with structural adjustment in the 1990s and the early 2000s, which wrecked the economies of the developing world and brought a lot of money to the World Bank, the IMF, and industrial countries. Mm-hmm. So what we're dealing with is a kind of endemic colonialism, which we've never been able to cut through. Today at the United Nations, as we're talking, they're having a one-day session on COVID-19. 100 heads of state have pre-recorded videos. 40 ministers of health have pre-recorded videos. I can assure you that they will never mention HIV from beginning to end. It will be complete obsession with COVID, and there will be no offer of financing. There will be no guarantee of the vaccines. There will just be a tremendous outpouring of rhetorical goodwill, which never saves lives.
Yes, and I agree with that, and that the mistrust is there. Why should some of these countries trust these big bodies to save them? And yeah, you're right. That is why your voice, our voice, and on HIV/AIDS is so important. It was World AIDS Day, and I didn't really see that much still on it's one day a year of a focus on HIV and AIDS, and it was still COVID, COVID, COVID. And like you're saying at UN, it's still COVID, COVID, COVID. And still people are dying every day. Millions of people just don't have treatment for HIV and AIDS. So our voice is definitely super important.
Terry, just to make the point that these other infectious diseases like HIV and TB and malaria and the whole realm of sexual and reproductive health, and the realm particularly of sexual violence, all of these tremendously important human issues are being treated as collateral damage where COVID-19 is concerned. It's as though we can only have a focus on one thing called the coronavirus, and so many other aspects of the human condition which are at risk don't get dealt with. And that's extremely painful. And it's heartbreaking to see the toll still that's being taken by these other diseases and circumstances. And all of the focus at the moment is on COVID. Understandable focus. Whole economies are being wrecked, but that doesn't mean you abandon everything else.
Exactly. And it's particularly, I'm glad you touched on gender-based violence, because particularly in South Africa, we're really working hard, AHF, with a whole coalition of faith-based leaders, and community leaders to address this, because it's gone up significantly. And, our largest number of patients on ART and all of our clinics is in South Africa. And we've seen a gender-based violence just go up so much. Also, another issue that we're addressing with our Girls Act are particularly girls, but boys, youth falling out of school because of COVID. And particularly the girls are not going to get back in school. That's what the boys will probably get back in school, but there's going to be a big number of girls that'll never make it back in school. So you're right. This is like the collateral damage of COVID, but these are real problems. And it will also drive HIV because it's part of prevention. If girls are not in school, then there's a chance they're going to get pregnant. There's a chance they're going to get HIV, and that could have all been prevented. So, definitely agree with you on that.
And certainly the reality of sexual violence, both the intimate partner violence, which everybody understands is so severe now because of the lockdowns, but generally speaking, the sexual violence that shows the terrifying gender inequality in the world, that's something which we have to take into consideration. I've always been stunned by the simple statistic that 5,500 young women and girls between the ages of 15 and 24 get infected with HIV every single week of the year. How is it possible in the year 2020 that 5,500 young women and girls should be infected by HIV every week of the year? I mean, historians looking back will wonder whether there was some kind of moral anchor that disappeared beneath the waves of human concern. It's just nuts that should be happening. And by the way, Terry, and you will know this as well as I do, this has been true for the last decade. We've made almost no progress on that front at all. And that is really that is really annihilating.
Yeah, thank you for that. And I'm going to jump to another question I had about condoms. So I'm going to jump to that because we're very focused on prevention, but also HF's never let go of the importance of condoms in the equation of stopping the transmission of HIV. And it has been politicized against us for more than 20 years. And condoms are clearly an effective tool to prevent HIV, and still are, and they're the cheapest. And this caused such a controversy back in the day of the forced prevention, measure. And many refused to promote or use condoms. And in fact, AHF was attacked many years ago as condom Nazis. And, our condom initiative calling for just a simple thing, calling for free condoms, in the bars, was rejected by the community, by city leaders, and by all other AIDS organizations in Los Angeles. AHF stood alone, on this, and it was defeated. But it ended up, you may lose the battle, but you win the war, because all the condoms did get free into the bars, but the community outrage of being forced to do something for prevention is what brought it down. And so do you see any correlation with that, the politicization of condoms and the politicization of face masks with COVID? Because many people are comparing the two.
Well, I don't know whether they're a direct comparison, but it's certainly true that, the face masks 3 months ago were not de rigueur, and now the face masks are everywhere and considered to be vital to prevent the spread of the coronavirus. And I salute you for the work on condoms. I can remember, Terry, when I was moving through the various countries of Africa, which was my job at the time as the envoy, the people on the ground, so many people on the ground understood the importance of condoms, but the religious leaders and the political leaders were all hung up on their own sexuality. I don't know how else to describe it, because condoms are such a significant measure of prevention. But it's interesting, in the same UN AIDS report that we've been talking about, that it points out that one of the targets for 2020 was 20 billion condoms to be distributed, and we've reached roughly 55% of that.
Yeah.
So there is still a very slow response. And the analogy with masks is interesting, but it's tough, Terry, because the United States is going through a period of palpable lunacy. You've had a very unstable and, frankly, I think, mentally ill president for a number of years.
And it's not funny. It's true.
And no, it's terrifying.
Mm-hmm.
And what it has done to the rest of the world. And with Trump running around the country denying the legitimacy of face masks, so the people who should be setting the standard are entirely delinquent. And the face mask controversy has been particularly acute in the United States, and of course, then it gets reported around the world. In my country, in Canada, there are groups of people who resent the lockdowns and the face mask use, but they really are in the minority, and they're not a very vocal minority either. I think the face mask phenomenon has been exaggerated and accentuated because of the crazed battle in the United States. Most often, where you get responsible political leadership, the country is prepared to follow, and that's been true in more countries, particularly in the European Union, country like Canada or Australia. But you're right in the analogy. We started off with grave concerns about face masks, and now it's recognized as indispensable.
Yes, and we've been on such a roller coaster craziness with this from leaderships and experts in the United States that many people don't trust any of them anymore, including myself. I don't know. We don't know who to trust in the U.S. leadership.
I trust
the coronavirus task force, the CDC, the FDA, the White House, like your local state, health department, your city state department, your county. It is so confusing here for the people of the United States. I'm just sharing that we're very frustrated as well. It's like, I'm sure we know the world looks at us like the United States has gone cuckoo, which I think we have in many ways. But my next question, it kind of leads into this, is that this conference focuses on the Americas. And what do you think is the main factor on why your home country of Canada, which is part of the Americas, is doing so much better on COVID-19 than most of the rest of the Americas? What does Canada have to teach the rest of us in the Americas?
Well, I don't know whether I'd be so presumptuous as to say we have to teach other countries, but Canada doesn't have a congenitally lying leadership. I mean, when you've got a leadership that lies from morning till night, it's very difficult to deal with the response to the coronavirus. Canada also tends to believe in science. And you would find, I think, overwhelmingly that most Canadians would think that Tony Fauci is somebody to be relied on in the midst of all of this. And we also have public health insurance, Terry. We have Medicare in Canada.
Yep.
We have the kind of thing which Bernie Sanders was pressing in his run for the nomination, and which so many Americans, curiously enough, well, it's not curious, you have this intense individualism and entrepreneurialism in the United States, and it's done the United States great damage. And I can remember at one point of my life tramping across the United States almost for a year, talking to groups about the value of public health insurance and what a difference it made to the knowledge of the public generally on how to deal with the kind of phenomenon that COVID-19 presents. So we have a health system which is pretty good. It's not perfect. We have a reverence for science. We have a political leadership. And by the way, I'm not of the political party of the Prime Minister and the government, but they've been pretty straight with Canadians and talking openly and directly day after day. And this makes all the difference in the world, rather than having to deal with a tissue of lies from morning till night. Nonetheless, Terry, I should say we've had pockets of incendiary horror. What's happened in Canada in the long-term care homes have been pretty awful. Something like 70 to 80% of the deaths have been in long-term care homes. And because I'm clearly over the hill and in a geriatric phase,
you don't look it.
I'm very sensitive to long-term care. But that has been a great failing in Canada. And there have been some considerable mixed messages from time to time over what the nature of the lockdown is and how severe it should be and what stays open and what is closed. But on balance, by comparison, forgive me for putting it this way, with the United States, we're a country of angelic perfection. And in truth, we have a lot of failings and flaws, but we've handled the coronavirus pretty well, although it's rising in numbers now. Canadians are pretty anxious over what's happening.
Yeah. Okay. Well, we are as well here too. I'm concerned about long-term care facilities. So my father's 99 in a long-term care facility, and he's about to hit 100. So we want him to hit the 100 in April. But they haven't had one infection, COVID, in the staff or the residents there. So we're happy for that. They shut it down in March. They shut down, all families out in March, and we were, families were upset about that, but it worked. I mean, they haven't had one infection, so it's tough. It's tough not to you can have limited visits, but the elderly and the care facilities, it's really hard. And we feel so bad for people that have died in facilities without seeing their families.
Well, you have emotional dehydration on both sides.
Yeah, yes, we do.
Tremendously.
I want to address a bigger issue that you talked about in what I call your fireside chats, that you send out in your cyber fireside chats this week. And in that video, you spoke about the correlation between HIV/AIDS and COVID in regards to patents and TRIPS agreements. And I think this is very important. AHF, we were very involved in fighting for the reduced drug pricing in South Africa. I was there, and we had lots of advocates there that worked with us. We protested the GSK offices in Durban. We protested, GSK are all, in England as well. And so those battles resulted in with many people working on it, TAC, all kinds of people, on the reduction, and millions of lives were saved because of that. We wouldn't have been able to sustain at those prices. We had a waiting list at our clinic in South Africa. We could only pay for 100 patients, $5,000 a year for each patient, and people were dying on the waiting list. And that just gave us a sense of urgency. We've got to get those drug prices down, and that's what happened. So can you take us through a little bit what you were talking about earlier this week on your video, the history of that and how it relates today to COVID and vaccine and testing and treatment access? What are the lessons learned from that?
Let me ask you, Terry, what years were you there fighting at?
2000. It was 2003, 2004, 2002, 2003, 2004.
Yeah,
beginning.
because that was already, I mean, the so-called TRIPS agreement, which deals with intellectual property rights within the World Trade Organization, and the Doha agreement. TRIPS was 1995 and Doha was 2001. So I guess I can say that there are probably people watching and listening who have a much better grasp of this than I do. But fundamentally, of course, what you were fighting was essentially patent protection. What you were fighting was the right of the pharmaceutical companies to set the prices they wanted to set. And it was that extraordinarily heroic intervention on the part of all of you who demonstrated and clamored and confronted the pharmaceutical companies in court. All of these things ultimately brought the change that was required to get the prices lowered. And it was pretty courageous, I think, all in all, because eventually you were importing drugs at lower prices and you were doing some internal manufacturing in South Africa as well. In other words, you were taking the intellectual property rights, which were guaranteed in the TRIPS agreement, so-called, in the WTO, and you were taking that agreement and pushing it to the outer limits. That was an agreement which said, yeah, we're going to have patents that protect drugs, but we're going to give you some flexibility. And the governments of the world found that the flexibility wasn't sufficient. That is to say, the low-income and middle-income governments of the world. So in Doha in 2001, in another memorable meeting of the World Trade Organization, they said, look, global public health is more important than patents. You can use TRIPS to implement global public health. And gradually that gave comfort and energy to the vast array of civil society, which decided to take on the pharmaceutical companies as you did. And it also gave power to India to have court decisions, two very important court decisions, which overruled pharmaceutical companies like Gilead and said, we're going to allow generic production of these drugs. So you're not going to pay $5,000 or $10,000 per person per year. You're going to be able to pay $350 per person per year, and we will supply the drugs at that price. What has happened now, which is so interesting, Terry, is that India, South Africa, Kenya, Eswatini, a number of low-income countries have gone to the World Trade Organization and they've said, look, TRIPS still isn't working. We need a complete exemption from patent protection during the course of the pandemic. You've got to waive the patent protection utterly during the course of the pandemic. You can reinstate it when the pandemic is over, and WHO has said it's over. But during the course of the pandemic, we want no right given to the pharmaceutical companies to set the price and set access. And at the moment, this will be voted on in a couple of days. At the moment, the donor countries are saying, no, we want to protect the profits of the pharmaceutical industry, and we think you've got enough flexibility in TRIPS as it is now. You can order a compulsory license, which is to say you can take away a patent and order a compulsory license. But if you do that, you have to pay royalties to the drug company. It's so complicated. So these low-income countries have said, thinking back to what happened with HIV, we don't want to go through that again. We don't want to have another monster fight. Just get rid of the patents for the course of the pandemic and make it possible for the low-income countries to have vaccines for no cost or at very low cost. No cost for the people who receive them.
It's just so morally unjust, the profit making that's happening, not even just with Amazon and Bezos. I mean, there's just billions of dollars being made here on COVID, and COVID has taken over everything in our lives, and it has destroyed so much, but it has generated so much profit for companies, particularly. And what about these pharmaceutical companies? It's not right that these pharmaceutical companies make billions of dollars of profit of a life-threatening virus that's shut the world down. People are suffering all over, and yet you're right. The government, the institutions that are supposed to control this, are bowing down to the power, the unlimited power of the pharmaceutical industry, right? And you know that AHF, we have always been a strong opposition voice to the pharmaceutical. We're not afraid of them. And back to in the very beginning, I just remember that it was our first time we ever went to a shareholders meeting was in London, and Michael Weinstein thought of it. He said, let's just go to the GSK shareholders meeting in London. And we said, oh, okay. So we've done that many, many times for all the companies since. That really gets them, to embarrass them in front of their shareholders. But that was the very first time, and that actually helped. But you know what, Stephen, I don't know what it's going to take to get these pharmaceutical companies in line now, because seems the world, these world bodies that are supposed to be controlling them are bowing down to them.
Be interesting to see what was said today and what the vote will be in the WTO.
Yes.
They have 164 members, and they need 123 votes to pass the resolution that South Africa and India have proffered. You're quite right. It'll be interesting to see. But look, these companies, they're getting advance purchase payments.
I know.
This isn't payments that come after you sell the thing on the
billions in advance.
Billions in advance for
shocking
hundreds of millions of doses, which are designed for the wealthy countries,
and that are fast tracked, and that may not even be safe. I mean, the long term side effects of these vaccines, the two that are coming out now, there's no knowledge of it because they're fast tracked. So, but there's still billions of dollars of pre-orders.
Yes,
and it's a crazy time.
We're all of the various health sectors of the governments, the sort of equivalent of the FDA in the United States. Everybody's examining the drugs pretty carefully, including Canada. So they haven't been approved in Canada yet, even though we've purchased Moderna and Pfizer and AstraZeneca. It hasn't been approved yet in Canada. And believe me, this is becoming an extraordinary political battle.
I'm sure.
It's just nuts. It's just,
well, you've probably seen that the percentage of Americans that say they won't take it. I think it's I think only 55% of Americans will say they'll take the vaccine, and then 30% say no, and then another 20 they don't know yet. Yeah. So it's like that's because of also the mistrust we have in our whole health system and the leadership that has told us mixed messages, from the beginning. So there's a problem with trust.
What you need in the United States is a universal therapy system. You need people in intensive one-on-one therapy
exactly,
in order to understand what they are absorbing and supporting.
Well, mental health has never been a priority in the United States, and it certainly hasn't been for the last 4 years, in Washington. So I want to ask you a question about activism. So over the years, you've been there and through it all, and I've been through a lot too, but the HIV/AIDS pandemic generated a lot of activism. I was in ACT UP for 10 years, and of course, I've been an activist all through, and a lot of social mobilization, as well as society sensitization for the issues. So all of that. Do you think the same is happening with COVID-19? Or how do you feel about the state of and also besides COVID-19, what is your thought about the state of global, public health activism?
Okay, let me acknowledge, Terry, that you've been a much more prolific and energetic activist than I have. You've really been on.
We do have different styles, but you're both effective.
You've been on the front lines and on the ground, and that is a kind of symbol for AHF. That's I watch it, I follow it, the material that comes through, and there is this tremendous urgency and determination and activism on the ground. I really honor that. My activism hasn't exactly been cerebral, but it's been more an advocacy, clamoring at the outside, begging people to pay attention, to take action. And I'm kind of I don't think I need give judgment because it's such a difficult time to make pronouncements, but it's clear that activism is in a trough. Activism is in a difficult period, partly because people can't get out. If activism is to think of the Black Lives Matter movement before COVID hit, and even in the early stages of COVID, the demonstrations on the street, the gatherings together, the sharing of materials, etc., all of that is now truncated by virtue of the virus. It's just so much more difficult. So it's hard to organize the activism, through Zoom calls, because you'll get a Luddite like Stephen Lewis who doesn't know how to connect, and you lose 20 minutes of your call.
That's
no,
okay.
I'm serious. This is a very significant diminution of activism.
It's true.
And COVID-19 has wrecked so many societies in economic terms and caused so much panic-stricken anxiety in health terms that it's been much more difficult to energize the activism that came with HIV, for example, that was quite magnificent and is pretty strong to this day, although it doesn't get the same kind of hearing. So my own view of activism is that this is one of the things that has to be stirred as soon as the pandemic is grinding down, when vaccines give people a sense of life again, then we regenerate a different kind of society, which everybody's talking about. Because frankly, the activism around health has to join the activism of the Black Lives Matter movement, has to join the activism of climate justice. These are the grand movements in the world, and the reality of climate is going to supersede what has happened with the coronavirus. It's going to be much worse what's coming with climate. And therefore, these grand international movements which stir the human soul and make governments change their policy, they have to come together, because fundamentally we're fighting for the survival of humankind in one manifestation or another.
Yeah, I know. I agree with that. And, I want to thank you and also Code Blue for being one of the few that actually joined us. And I want to ask, in the activism with sexual harassment issues at UNAIDS, we felt that was such a moral and an important issue to fight for. And you stood with us in Code Blue, and nobody else did. So in the AIDS, establishment would not address that sexual harassment at UNAIDS. But why was that so important to you that you did?
Well, in truth, my co-director, the woman I co-direct AIDS Free World with, and Code Blue, Paula Donovan. Code Blue was Paula's idea. She's a powerful feminist.
She is. She's
who is unflinching in her tenacity and commitment. And it was Paula who said, "Look, what's going on at UNAIDS is a disaster, and something has to be done about it." And we never let up on it. And I think, for your viewers, maybe some of them were distraught at what happened, but we were determined that Michel Sidibe should leave his post, that the culture of patriarchy, sexual abuse, and bullying in a major UN agency, or at least coordinating body, was just completely unacceptable. Yeah. And so we kept at it, and I fully noticed, Terry, that AHF was with it too. And I think we should point out that we managed to get, isn't this quintessential? We actually managed to get the appointment of an independent international expert group to investigate what was happening in UNAIDS and to produce a report that was scathing in its analysis and radical in its recommendations. And no one cared.
Nobody listened.
No one cared.
Yeah.
And when the countries got together to discuss it, they didn't even send the report to the Secretary General. Frankly, I don't think he would have done anything anyway, because doesn't really care deeply about these issues. But there was nothing in a serious response. Although finally it got so uncomfortable that Michel Sidibe left. Louise Lours went back to Brazil. We have Winnie Byanyima now as the new executive director, and there is a sense of change. Whether it's the right change or not, time will tell, but there's a sense of change. It makes you feel as though you can achieve some things, but boy, it's tough. Really tough.
It is tough. And for us, it was important that we believed the women, particularly, we stood with Martina Brostrom and other women, that came forward. She wasn't the only one. There were so many, and that they were not being heard. So right. We felt it was important. We've got to get them the voice. And we too felt strongly, and we were attacked, and many didn't, that Michel Sidibe needed to go, because that kind of leadership, condoning that kind of behavior, not acceptable. So we did win, on that one in some ways, but like you said, the report, is it being adhered to? I don't know. It's advocacy that we need to stay on, and we gotta need to keep looking at that. That's not gone down.
I agree.
Okay, another question, bigger issue. So the HIV/AIDS pandemic prompted the UN to create UNAIDS back in the day, and later the more specific financial mechanism called the Global Fund to Fight AIDS, TB, and Malaria, which we work with, and we feel the Global Fund does a pretty good job of if you compare all of them. So what do you, we're working on a new global public health convention with a very large coalition body. Do you think the time has come to create like a new UN pandemic force, or maybe a new global fund to fight pandemics, or something different than what we have right now? What is your thought?
I think that within the Global Public Health Convention, which is emerging with WHO's support, I think within that one has a significant division which deals with epidemics and pandemics. Behind the scenes, Terry, there is an intense discussion, particularly amongst the bodies that UNAIDS coordinates, all the other UN groupings. There's an intense discussion about whether or not UNAIDS should continue to exist into the future. It's the exceptionalism of AIDS, which you feel, I feel, whether that should now stop being siloed, the same with TB and malaria, and be integrated along with sexual and reproductive health and everything from sexual violence to child marriage, whether those ingredients, which are so perilous for the human condition, shouldn't come together under one major rubric, presumably an agency, maybe the Global Public Health Convention you're talking about. I'm not quite sure how I feel about it. I think the time is probably coming in the next 2, 3, or 4 years where there will be an effort to integrate the work of UNAIDS into a larger vehicle or body. Here I'm going to tell something that is not known, and I'm going to phrase it carefully because I don't need a lawsuit, I'll have to turn to AHF for subsidiary funding for food. There's every reason to believe that towards the end of his tenure, there was a great deal of traffic among McKinsey, hired as a kind of counsel, and Michelle, and incredibly enough, it is rumored, the Deputy Secretary General. I'd like to see a tabling of all the emails that McKinsey was involved in at that time. Nobody will admit it. Nobody will say anything, but we know enough about McKinsey now. I mean, you can barely open the paper any day without seeing McKinsey involved, sometimes in very good things and sometimes in things which are nefarious, like the apology McKinsey had to make to the government of South Africa for being involved with financial scoundrels. And I'd like to see the tabling of the emails which went on in the last weeks and months of the Michel Sidibe era, which ostensibly involved the Deputy Secretary General of the UN, although we won't know that unless they do table the emails. We know it by rumor from strong sources. So there was in those transactions, we've learned that that the discussion of the future of UNAIDS was part of the exchange. And one of the things that was discussed was the possibility of the creation of a super coordinating agency, which is what Michel Sidibe would take as his pension. He would be the czar of the new super agency that dealt with not just with HIV, but with other infectious diseases and looking at the role of the Global Fund, etc. It would be fantastic, to have access to see what was being discussed behind closed doors with a consultant like McKinsey. How does McKinsey get into everything from opioids to financial malpractice in South Africa? I mean, honestly, what is this firm? I don't get it. But everybody turns to them.
It's always also about, follow the money, follow the trails.
Yeah.
One of our priorities, to fight for in 2021, and has been, but even more so, and we're putting it in everything, is the fight for transparency and accountability. And that is what our advocacy is going to be with UNAIDS, WHO, all of them. Transparency. And what you're talking about here, release those emails. What actually happened there? Let's look at, but Stephen, is what we face is, and I don't know if you do, is Is there an appetite for this? You know, when we talk about our campaigns, our plans around the world in any kind of coalition, we're glad I know you'll be in coalition with us for transparency, but it doesn't seem like there is an appetite to know what the real numbers are. What are the real numbers?
Yeah.
Is it 26 million? Is it 22 million on treatment? How many don't have treatment? Do the governments really want us all to know, you know, the real numbers, the real situation? Does it affect the donors? You know, the priorities here are not what your priority is and our priority is, which is saving lives, the people on the ground, mother with 4 children. That's our priority. It's not their priority.
I'm not as skeptical as you are about the gross numbers, Terry. I think by and large, the epidemiology and the statistical gathering is pretty solid. You know, you're quite right. It doesn't always take into account adherence and how many people drop off treatment. It doesn't take into account some of them who succumb to treatment or succumb and it doesn't certainly take into account sufficiently the comorbidity between tuberculosis and HIV.
Definitely.
And the fact that a third of the deaths in HIV come from tuberculosis, the 250,000 people just last year. So those sorts of things are not, they're not as taken as seriously and as urgently as should be the case. But you're right about insisting for transparency. Here's something that your watchers won't know, I suspect. There's no freedom of information in the United Nations. Every single country, including the United States, Canada, every country you care to name, has freedom of information legislation, or at least the overwhelming majority of them. And you manage to get access to things which may be redacted, but you get access to some of it. There's nothing in the United Nations. You can make any request you care to make, and they won't even answer. They don't have to answer. And I'm sure this is true for you in AIDS-free world. We're multilateralists. We believe in the United Nations system. We just want it to operate honorably, transparently, and with access to information. And incredibly enough, it's not when you sit at the noon briefing and you ask a particular question of the noon briefer, all of whom are very competent people. They're skilled at their work, and they give you an answer you don't like, and you ask them to give you more. They don't have to. They say, you know, sorry, that's all you're getting, or come back and ask me again, and I'll get it for you. And when you come back, it isn't there. It's just astonishing. I sat in a legislature for almost 16 years. Mm-hmm. It would be unheard of that you didn't have access to information in a body politic. And that's what the UN
I think many of the women that were trying to bring their cases of sexual harassment on UNAIDS faced exactly that. They couldn't get the information, and they didn't have to be released. Right. So that's very frustrating. So that transparency is really important. Yeah. Well, we're gonna continue our advocacy with UNAIDS, particularly UNAIDS, and the question of should UNAIDS even exist. After this report, it's a good question. You know, because the money that's poured into UNAIDS went. What company, if it was a separate company, would continue to be funded at the levels it is if they failed on all 20 deliverables, you know, of their contract? I mean, that they wouldn't be continued to be funded. So we're going to have to see what we're gonna do. We need a revamp.
You understand, Terry, that UNAIDS simply says, well, we have nothing to do with that. That's all the fault of the governments. When in fact, UNAIDS has everything to do with it.
Right. No,
they should be leading this framework that engenders a really powerful change. Sometimes I think, Terry, when I read a report like that they should stop this complete obsession with numbers for absolutely everything. Just stop compiling data and start doing the work.
Doing something, yeah.
I'm really tired of reading the interstices of figures for absolutely everything, when in fact we're in a critical fight to, as you say, save lives and reduce illness and respond to an epidemic called HIV, which is still a scourge across many parts. Look, the numbers have gone up in Eastern Europe. They've gone up in Central Asia. They've gone up by 21% in Latin America over the last several years. The only places the numbers have gone down are in East and Southern Africa, but still it's terribly high. They've just been reduced from where they were in 2010 over the last decade. But and they're going up in these high risk populations of men who have sex with men and sex workers and injecting drug users. Those have appalling rates of contagion around HIV in parts of the world. And we know what's happening to women and girls. So there is a catastrophic element here. Stop with the endless procession of statistical tables and just do the work. Get it done.
You're preaching to the choir here, because AHF, we were so bad for so many years at doing reports and showing all the data of all that we're doing, because we were too busy doing it. We always said just don't write a huge plan that takes 12 months to write. Let's just get out there and start doing stuff, and saving people and avoiding orphans. To me, it's tragic when orphans are created, because you lose the mother and the father when you just don't have to. So we have what's unique with we feel to us, but I know you have it too, is a sense of urgency. We're so frustrated. I get so frustrated even after 30 years that where's the sense of urgency with all of these? And first of all, not just the big government bodies, but the NGOs too. Come on, people are dying, and we said it. I remember saying it to a health department official in South Africa, and when we were trying to urgently get something going in 2003, and I said, people are dying on our doorstep, and he just didn't have any sense of urgency with that. And sometimes, I'm sure you still face it. We face it when we're at these international AIDS conferences and all these, big conferences that cost millions of dollars. And everybody's just going around with the conference. Where is the sense of urgency? Yeah. We want to beat the door down and set the house on fire. We get so upset, and then we're called, AHF is, we're always causing trouble, or we don't get along, or whatever. But it's because we're trying to save lives. That's what it's about.
You have a pretty stoic and strong personality. They're not going to suppress you. You just have to stop short of physical violence. That's all.
No, we're not.
I'd like to engage in. I'm sorry, I'm such a quiet soul.
No, you're. I've not seen you quiet. But a couple last questions these are kind of bigger. Like, if the global leaders that we've kind of referenced here, Dr. Tedros at WHO, who's been under fire, for a lot of things. Peter Sands is the head of the Global Fund. Winnie, is the new head at UNAIDS, and then people include like Bill Gates in there too, which, we also question, why is Bill Gates even, on that list? Just because he's the second largest donor of WHO, gets to have such an influence on world, global health. What are your thoughts on that? But just if you were, the question here is, if you were sitting with any of these people, which sometimes you are, what advice would you be giving them right now in the middle of, in regard to responding to HIV during COVID-19? What would you call on them to do differently right now?
Well, I'd first of all, I'll never be invited to sit with them. Those days are gone. I'm persona non grata. But
well, that's a badge of honor. That's a badge of honor. But okay.
In the case of Tedros, I would ask him to be even more energetic in his capacity as Director General of WHO, and not to take the bruises and brickbats that are being hurled at him and obviously troubling him. I think he has to be really tough and assertive and aggressive. WHO has an important and significant role to play, and he should not subject himself to intimidation. I saw him in Ethiopia. We spent some time together at conferences. I remember one conference in particular. I was very, very impressed. It was 2013, the regional conference of HIV. It was in Addis Ababa, and he was really an impressive guy, and as Minister of Health. And I think he has to assert himself even more vigorously and not accept the lacerating kind of slamming which he receives from time to time, which was true in the United States. Around the Global Fund, frankly, what the Global Fund needs is a far more imaginative leadership than Peter Sands has provided. He's a very able man. There's no question of that. You listen to the fellow, he's a complete master of his portfolio. He knows it back and forth. But here's the truth. They asked in the last replenishment for $14 billion. They knew they were going to get it. It wasn't a problem. But they also knew that the total amount they really needed to deal with the 3 infectious diseases adequately was $32 billion. And they couldn't bring themselves to ask for more. That is collapsing before the interests of the member states who decide in advance, we'll give this and no more. And instead of naming and shaming them, instead of going after them for more, Peter Sands and the Global Fund, it's not just Sands, it's member governments, were willing to have a shortfall of $18 billion. So now along comes a coronavirus. They have to allocate additional monies for it in order to protect the work they do with infectious disease, and they don't have the money. They have $1 billion here, they have several hundred million there. But if they'd asked for even 18 billion, which many of the NGOs pleaded with them to do, people like Jeff Sachs were arguing so effectively and persuasively for the 32 billion, but they were absolutely paralyzed by the diplomatic maelstrom which they faced if they asked for more money. And I would say that the Global Fund has really been deficient in setting its targets. They should be much higher.
I know. We absolutely agree with that. We urged for much higher than 12, 12 or 14 million. When there's $1 billion, when there's so much money, there's plenty of money to fund this. Why not ask for it or demand it? You're right. And just to accept that shortfall, it costs lives.
Terry, look at the money we found for
COVID.
Economic recovery and for COVID, yes. And Winnie should spend less time mirroring the tenets of Oxfam, for which she comes.
Or sending out press releases, because we get just endless press releases from UNAIDS. I don't know what else they're doing. I mean, just endless press releases.
They're doing a lot, to be fair to them.
No, I know from the head off. I mean, I'm talking about just as a global leadership voice.
They need to. They need to just single-mindedly focus on HIV. Focus on HIV in the coronavirus. It was great for Winnie to talk about people's vaccine. You got to talk about a people's vaccine for HIV and a people's vaccine for tuberculosis. You can't get sucked into the vortex of the coronavirus without understanding all of the implications for everything else. And finally, about Bill Gates, I want to tell you, you have to be respectful of the guy because he commands such presence and such enormous wealth. But the fact of the matter is that early on, he said, I'm turning everything over to the coronavirus. He gave a signal to so many foundations and so many wealthy philanthropists that was their job. He was setting everything else aside. And I think he did us a great disservice. His voice commands a lot of attention, and we're struggling now to stay alive, to survive as organizations, and to get the focus on things other than COVID-19, partly because Bill Gates said to the world, look, I'm turning myself over to COVID-19, whether it's the discovery of a virus or treatment or diagnostics, and everything else is subsidiary. Well, everything else isn't subsidiary. This is a world with many dimensions, and you can't be so blinkered, so myopic that you focus on only one dimension.
Well, I agree, and we have great concerns about Bill Gates and the influence of the Bill and Melinda Gates Foundation on global public health. Like, what gives them that platform besides huge cash roll into WHO, and most people didn't really realize that when Trump, which either happened or not, said that we were going to pull the United States out as the lead donor, the media didn't actually say, okay, wow, if that happens, does everybody know who the second biggest donor to the World Health Organization is? Bill Gates. And his agenda would be driven under that power. I have my own experience from many, many years ago, like when we started our Treatment Equals Life campaigns, and we were really trying to fight for treatment. We tried to work with the Gates Foundation on treatment, on test and treat. because we also think there is a formula to stop HIV/AIDS. It's test and treat, and with prevention and condoms. So we got it. We can do this. There's no reason for all those girls to be, infected every week. But you know what? They weren't interested. All they were interested in was vaccine. This was like 15 years ago, or 12, 15 years ago. Vaccine. And we said, but there's an answer right now. These people, the vaccine's good, and we want a vaccine, but we need to save these people right now that are going to die. Millions of people are going to die. You know what, Steve? They didn't care. I mean, they had no interest in it. It was all vaccine. So when I see this now, it's still all vaccine. Now it's COVID vaccine.
Yes.
And before it was HIV vaccine, which never happened, and billions and billions and billions has been spent on focusing on an HIV vaccine. Now billions spent on COVID, and there's Bill Gates again. I have a real concern with it.
Well,
and
that's his area of interest, Terry, is these techniques that will. I sat on the board of the International AIDS Vaccine Initiative, IAVI, for a number of years, and it received pretty heavy funding from Gates, not billions, but certainly millions. And Gavi in the UK, now headed by Seth Berkley, who headed IAVI at the time, receives tens of millions from Gates and support from Gates. So it's not only WHO. He has
I know it's not just WHO. Yeah,
a great reach in many areas, and I don't know whether it's a matter of caring or not caring, because he would never submit to the idea that he doesn't care about the human frailty, but he would say, I'm going to approach it this way through technological fixes. And because of his inordinate wealth, that becomes the focus for so much of the world. And whether he's right or not is a real question mark. I think you can make a very strong case that he made a mistake in judgment to so completely be preoccupied with the coronavirus, virtually at the expense of everything else, that the messages that went out really prejudiced our capacity to respond. He would presumably profoundly disagree, and I respect that. But it's hard to disagree with Bill Gates because his reach is formidable and endless. Maybe you can.
We can't, because when your reach is formidable and endless because of the money you have on world health bodies that are determining our global health, that's very concerning to us.
Yes,
that shouldn't be how it is.
Right.
We feel that you shouldn't be able to buy influence on global public health, because what if you really? I'm not saying he does, but what if somebody has a bad, not a good agenda for the world, and you can buy that influence? That's not our structures. So we're really going to go for the Global Public Health Convention that sets new parameters and design and reframe this and revamp our whole system that would help prevent this. So I have one last question for you, Stephen, that would close it out. And that is basically, if you, Stephen Lewis, in Canada, were somehow elected the new head of global public health tomorrow, what would be the first priority action you would take, to improve this a little bit broken system that we've been talking about, and to save? I know your focus is save millions of lives. What would you do? Tell us.
I would have not one but two initial.
Okay, you can have even three if you want.
One is to make an all-out push on resources, as hasn't been done before. And one of the ways to do it is to name and shame the countries that have provided so little when the need is so great. My own country has amassed a deficit now of something like $400 billion. That figure was revealed just a couple of days ago in a financial statement in the House of Commons in Canada, and we've never come anywhere near that. And if that kind of money can be found, and that's one of the reasons, by the way, we did better than the United States, Terry, because we have really supported people who lost their jobs, small businesses who are frantic to survive, systems which are needed. We poured the money in, which hasn't happened always in some countries. And I think the absence of resources for HIV to make a real difference is a really a crippling factor. And the second thing I do, if I had any opportunity at all, is to unleash the NGO community. Because this, and now I've watched it from the inside and I've watched it from the outside. And the basic indifference and contempt for the work of NGOs that exists in so many of the major international agencies of the UN and beyond, including governments, it's just reckless and unacceptable. And NGOs have so much intelligence to offer and so great a sense of social justice and the need to preserve humankind, and their voices are heard only on the periphery and only in an incidental way, and they're sucked into the quicksand of diplomacy, and eventually they lose their energies. I would find a way to bring the NGO community into the center of the public and policy response. I'd love to do that, but unfortunately, I'm too old and decrepit, so I'll never be head of anything. But it's lovely to chat with you.
Let's try to do it together, because I so agree. The NGOs are the ones on the ground with the passion making it happen. They don't have the money. Right. You know, they don't have the billions to get this influence, but they have the passion, and they are with the people on the ground. So, let's try to do that together. Let's try to really do something in 2021 to really empower the NGO world, because I love that solution.
I won't resist that, but I did see, Terry, and I have seen, because I spent, since 1984, which is now 36 years, I've been involved either directly within the UN or indirectly to the UN, but always UN related. And I was always struck by the phenomenon of the pretense around the NGOs, that it would always be whatever tokenism you could get away with. And behind the scenes, there were contemptuous and dismissive remarks made about the NGOs not knowing enough or not skilled enough. And I've learned over time that that's just palpable nonsense. It's absurd slander, because there are numbers of NGOs in this world who are magnificent. And were they given an opportunity to frame policy, it would be a different world. And I'd love to help with that.
Great. Let's do it together. We really thank you today for this chat. You know, I think it's been really great, and some great ideas, and we loved hearing your thoughts. And let's work together, all of us, for a new global public health convention and revamp the system, because lives are at stake, and this doesn't have to stay like this. You know, if we keep our passion, we keep our voices, and we empower the NGOs, and we challenge the governments. Like you said, we've got to challenge the governments that report up to these bodies. And then also challenge these bodies to do better, especially WHO, UNAIDS, and the whole UN system. We can make a change. And so I really enjoyed meeting you today for the first time. Thank you so much.
It is a pleasure, and thank you, Terry. It's been good talking to you.
I hope the next time it's in person and we can get through COVID.
Me too.
Thank you, Stephen. So thank you for everybody for joining as well, and thank you for hanging in. We've got a little bit of a late start, but thank you for hanging in, and I hope you enjoyed the discussion.
Thanks.
Thank you.
Bye-bye.